Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, in honor of Earth Day, our topic is planetary health. Dr. Sam Myers is the founding director of the Planetary Health Alliance and the director of the new Johns Hopkins Institute for Planetary Health. He joins Dr. Josh Sharfstein to talk about this new field and why it's important not just to the Earth, but to all of us who live here. Let's listen.
Dr. Sam Myers, thank you so much for joining me today on Public Health on Call. You are the new director of the new Johns Hopkins Institute for Planetary Health. And I want to start by asking you, what is planetary health?
So nice to see you, Josh. So planetary health is a very young cross-disciplinary field that's emerged in the last 8 or 9 years that focuses on how our transformation of nature, our degradation and alteration of all of our planet's natural systems is coming back to affect our own health. And so, climate change, biodiversity loss, global scale pollution of air, water, and soil, changes in land use and land cover, all of these ways that our activities collectively are changing our planet's natural systems are driving increasing burdens of disease. And we're trying to understand, what those dynamics are and how we address them.
Sounds like you are looking across a lot of different problems at the same time.
No doubt.
Could you maybe take us through one of those problems? How do you think about planetary health and, say, oceans, for example?
You can pick any dimension of human health, from nutrition to infectious disease to non-communicable diseases to mental health, and you can see a ton of examples of how biophysical changes that we're mediating are coming back to affect our own health. So in oceans, for example, we know that ocean warming is changing the size of fish and the size of fisheries, and is also changing the distribution of fisheries and moving those fisheries away from the tropics and toward the poles. We did a study in which we analyzed how many people depend on wild harvested fish to get critical nutrients for their own health and who live close to a threshold of insufficient intake of those nutrients. This is sort of what we define as the vulnerable population to these changes in where people can access wild fish. And we found that the answer was over 1 billion people fell into that category who are threatened as ocean warming is leading to reduced access in the tropics to the fish that people depend on. So that's one example just of fisheries and nutrition, but you could pick really just about any disease or any dimension of health, and I could give you an example.
That is a great example, because I don't think I've ever thought about global climate change that way before. Let me ask you maybe about another dimension, agriculture and the kinds of crops or the quality of crops that are going to be produced in the future.
Yeah, so this is an area where I've done a lot of my own research and where there was some preliminary data from sort of laboratories and greenhouses that suggested if you grow crops like rice and wheat and maize, the things that provide most of the calories in the global diet, if you grow them at elevated concentrations of carbon dioxide, concentrations like the ones we expect to see by about the middle of this century because of our burning fossil fuels, that those plants tend to actually lose nutrients in the grains that we consume. And we got interested in this because the nutrients that were being lost were things like iron and zinc and protein that are super important for human health. And so we did what's called FACE experiments, these free air carbon dioxide enrichment experiments. And we grew 41 cultivars of those kinds of crops on 7 locations across 3 continents over 10 years to get a big sample size of these different kinds of crops grown at elevated CO2. And we did find that, in fact, growing these staple food crops at high CO2 reduces the amount of iron, zinc, and protein that they contain really significantly. And we spent several years after that sort of modeling what that would mean for the total intake of those nutrients for populations in 150 countries around the world, and showing that likelihood is that around 150 to 200 million people get pushed into nutritional insufficiency of things like iron and zinc and protein simply as a result of that CO2 effect alone.
That is another major impact that crosses between the environment and human health, because, of course, downstream from those nutritional deficiencies are all kinds of physical symptoms and early death and other kinds of problems that people can experience.
No, that's exactly right. And other groups have done research on vitamins as well. For example, growing different cultivars of rice at elevated CO2 and showing that, for example, the B vitamins are reduced by almost 30% when grown at these same levels of CO2. And we use that data to model what that would mean for risk of things like neural tube defects and other, B12 and other vitamin B deficiencies, and found really, really large impacts. So it's true that these are large effects. And what's a little bit concerning is that this is just one very, very specific biophysical change. We're talking about the amount of CO2 in the atmosphere, but we're changing all the biophysical conditions that our entire food production system has been developed to be optimized under. So temperature, precipitation, amount of arable land, pollinators, pests and pathogen relationships. And so all of those things are now changing in response to our own activities in ways that usually represent headwinds for global food production. So there's a quality problem, but there's also a quantity problem associated with those headwinds.
Is one of the starting points of planetary health that the changes that humans are causing the environment are of such a scale now that the consequences may also be of an extreme scale?
Yeah, no, that's exactly right. And, there have been related fields like One Health or Eco Health that have highlighted some of these relationships between environmental change and health. But planetary health as a field sort of emerges in a moment of urgency, a recognition that the pace and scale at which we're transforming all our natural systems has become a global health crisis. And it's pretty fascinating in the sense that it's kind of a silent pandemic. And I was actually, for some reason, thinking about this morning and thinking about the parallels to the COVID pandemic we're coming out of. And imagine, a global pandemic that requires sort of massive mobilization, new technologies, investments in economic stimulus, in foreign assistance, respect for the science in the community, and global urgent behavior change, right? And we could be talking about the sort of silent pandemic associated with all the global health impacts of the Earth crisis, and it would look very, very similar. And yet, here's a silent pandemic that, in fact, looks to be much more durable and probably much more impactful to human health that we're really doing very little to address.
So I teach a course now called Crisis and Response in Public Health. And one of the things I teach the students is that you really can't respond to a crisis until you recognize that there is a crisis. You call this the silent pandemic. You are trying to raise a flag of concern over planetary health. How is that warning signal being received?
It's been really exciting in the sense that the field is growing very, very quickly. And the Planetary Health Alliance, which you mentioned at the outset, is something we started about 8 years ago. We now have 400 plus organizations in over 70 countries involved. But more importantly, there's just been a very rapid proliferation of new courses in planetary health around the world, new degree programs, new journals, but also government agencies adopting planetary health as a frame, the European Union, certain national governments, the UN system. So there really has been a sort of rapid understanding and proliferation of, recognition that this is a problem, that there is a global health urgency related to the Earth crisis. But of course, that's what we see. And it's a drop in the bucket compared to what we really need to make happen to fully mobilize to address the crisis.
Is one of the motivating principles of planetary health that there are solutions that can address multiple problems at the same time? In other words, that there are core drivers, and if you deal with the core drivers of problems, maybe we can lessen some of the various symptoms that our patient planet Earth is experiencing.
Yeah, that's an interesting way to put it. I mean, I think one of the sort of core tenets of the field is that they're co-benefits, right? And that's sort of what you're describing. So certainly the diagnosis of planetary health is that the way we're living is choking the life out of the planet. And that includes us, that we're seeing the sort of crumbling of these natural life support systems. And we can talk more about, what that looks like. But if that's the diagnosis, right, then the treatment has to be changing the way we're living to shrink our ecological footprint so that we can protect and regenerate these life support systems. And what's exciting is, first of all, there's a very rich landscape of solutions. So there are lots of ways we already know how to change the way we're living, but also that a lot of those ways also have these major co-benefits. So switching to renewable energy is going to be important to addressing climate change. It's also going to be really important in reducing the amount of air pollution that's driving something like 9 million deaths every year. And so that transition to clean energy has this massive co-benefit, designing our cities so that they're walkable and that they're bike lanes and that we green our cities have huge benefits in terms of ecological impact of the inhabitants, that we're reducing, again, greenhouse gas, increasing biodiversity, but they also have big mental and physical health benefits. There are a lot of things like that where the goal is to sort of, from a policy standpoint, find that sweet spot where we're both optimizing human health and well-being and reducing our ecological footprint. And there are a lot of ways to do that.
You mentioned the Planetary Health Alliance. It sounds like a group of superheroes. And I'm sure in a very real sense, they are, if they're fighting for the planet's health. Could you talk about what it actually does on a daily basis?
Yeah. And let me just be really clear that that community probably wouldn't tell you they're fighting for the planet's health, even though that's what it sounds like with planetary health, that what they're fighting for is human health. And many of them are fighting for the health of other species, but that it's a recognition that human well-being and all of life on Earth depends on stable natural life support systems, so that disruption of the climate system, degradation of biodiversity, pollution, land use change, these things are interacting with each other now in a lot of very complex ways that affect these foundational conditions for all life on Earth. The quality of air that we breathe, the quality of water that we consume, quality and quantity of food we can produce, the exposure to infectious disease and extreme weather events. So these things are driving this urgent set of health problems. And the planetary health community is not so much concerned about the health of the planet, which is an inanimate object, but is concerned with the health of human beings and other species. And what the Alliance is doing is really functioning as sort of the backbone organization for this growing global field. And so that includes, curating the new knowledge, writing the first textbook for the field, developing sort of core competencies for education, creating an educational platform to support educators in planetary health around the world, organizing the annual meeting. This one will be in Malaysia in April, putting out newsletters. So all the things that you kind of imagine a professional society would do, except we have this very interdisciplinary community. And so we're trying to create a global community of practice and support that community with those resources. The second half of the focus is taking that community of practice and the new knowledge and the sort of conceptual frameworks that are coming out of the field and connecting them to action. So what we call mainstreaming planetary health. And so how do you ensure that policymakers and the private sector and the broader general public is aware that the Earth crisis now represents a humanitarian crisis and that there are a variety of solutions that are good for people and the planet? And so that's the other major thrust of the work.
And just so I can get my head around it, how many entities are involved in the Planetary Health Alliance?
So we now have over 400 organizations in over 70 countries that are part of the Alliance, as well as about 20,000 individuals who are subscribing to our newsletter and engaged at the sort of more individual level.
And people who are interested can look online?
Absolutely.
The institute that you're starting at Johns Hopkins, tell me a little bit about that before we have to wrap up.
Yeah, so what's so exciting about the Institute is it really represents the first example I know of anywhere in the world where an entire major university is making a commitment to a cross-university effort to use planetary health as a lens to bring faculty and students together across every school and center in the university. And so the Institute itself will be sort of connective tissue that brings together people in the arts and humanities, engineers, the natural scientists, people in government and law and policy around this sort of central project of planetary health. And so we envision programs in the areas of research, education, policy, practice, and a sort of a clinical track. And already from the university, there are emerging all kinds of really interesting sort of interdisciplinary initiatives that draw on multiple schools and centers to design very specific work streams that are focused on planetary health, like a Planetary Health Cities initiative that we're getting started, another one on indigenous health and its convergence with planetary health, another one on food systems and the crops that nourish both people and the planet. So there are really interesting opportunities to use this as a lens to pull faculty together across the whole university.
Well, it sounds like the time is right for something like this. We're really excited, I know, to welcome you to Johns Hopkins. And thank you so much for joining me on the podcast.
Thank you, Josh. It's been great talking to you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ciceri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.